Good morning. You're watching BT Vancouver. Thanks for joining us. It is just after 7:30. Abbotsford police say one of their officers who was critically injured last week while off duty in Nelson is not expected to survive. 55-year-old Constable Alan Young remains on life support at a hospital in the interior. Police say his prognosis is grim. Nelson police confirm their officers responded to a disturbance in downtown Nelson, and Young was rushed to hospital. A 26-year-old man was arrested. There's no word on possible charges at this point. Abbotsford police say Young treated everyone with kindness and respect, and he always had time for a laugh. A cyclist has been killed after getting hit by a pickup truck on the Lougheed Highway in Maple Ridge. Emergency crews could not save him. Ridge Meadows RCMP closed the highway from 240th eastbound to 272nd Street in both directions for hours while police investigated. The stretch of road has since reopened. Vancouver City Council is expected to debate a motion calling for an end to police street checks and reallocate police budgets to reinvest in communities. The issue is on the meeting agenda for today. It was supposed to be discussed on July 7th, but was pushed due to time constraints. In Portland, Oregon, more anti-racism demonstrations since the police killing of George Floyd in Minneapolis. The protests have lasted 54 nights in a row now. This one led by a group of mothers dressed in yellow. The size of the protests keep growing in response to escalating tensions with police. Federal law enforcement officers have been sent to the city to protect monuments, but they've been seen cracking down on demonstrators. President Trump is also threatening to send federal forces to more cities amid ongoing protests. Well, as the province struggles with a record-breaking number of deadly overdoses, BC's Premier is urging the Prime Minister to take action and stop more people from dying. Travis Prasad reports.
June was yet another record-breaking month for fatal overdoses in British Columbia as the province continues to grapple with the opioid crisis. With an alarming number of people dying from illicit drug use every day, the Premier is now looking for help from the Prime Minister. In a letter to the Prime Minister, BC Premier John Horgan urges Justin Trudeau to develop a national plan to decriminalize the possession of controlled substances. By doing so, Horgan says the feds would take a, quote, enormous step to reduce the stigma around illicit drug use and encourage drug users to access recovery services. Horgan joins Canada's police chiefs who called for decriminalization of drugs earlier this month. One drug policy advocate says the letter is a step in the right direction, but it's also an example of the Premier kicking an urgent problem to Ottawa.
And over a year ago, his own provincial health officer, Dr. Bonnie Henry, had produced a paper saying how BC could immediately ameliorate the situation and de facto decriminalize drugs at the provincial level.
175 British Columbians died of drug overdoses in June, breaking an all-time monthly record set just 1 month before that. Border closures brought on by the pandemic have cut off drug supply chains, leading to extremely toxic illicit drugs. Donald McPherson says the provincial government is missing an opportunity by not taking charge in the same way it has with COVID-19.
If they were to put forward a decriminalization bill at the provincial level in the context of COVID, with the worst overdose death count in the history of the province, they would be seen as really caring.
When the pandemic was declared, BC doctors got approval to prescribe a limited variety of safe supply. Still, many continue to use deadly fentanyl-laced street drugs.
They have to expand that program to include more substances, and decriminalization would help that.
In Vancouver, Travis Prasad, City News.
7:35 now. The latest numbers show BC recorded 102 new cases of COVID-19 since Friday. Cases related to an outbreak in Kelowna on the Canada Day long weekend are now up to more than 60. Dr. Bonnie Henry says the new modeling data shows the risk of expanding our social circles too quickly.
What this shows is that we do have a possibility of having explosive growth in our outbreak here in BC if we're not careful in how we progress over the summer.
The province is expected to discuss enhanced restrictions for how bars and nightclubs will operate later this week. 2 restaurants in the Tri-Cities are dealing with outbreaks of COVID-19. Brown's Social House in Port Moody's Newport Village is open again. It was closed for a deep cleaning on Sunday after an employee came down with COVID-19. 3 workers at the Earls location on Shaughnessy in Port Coquitlam are self-isolating after testing positive. That restaurant is temporarily closed for a thorough cleaning. The business has been working closely with Fraser Health and believes the risk to the public is low. A new poll suggests a majority of Canadians worry a second wave of COVID-19 could affect their mental health. Miranda Fatour reports.
There's a lot of worry. As COVID-19 cases rise across the province, new research from the Angus Reid Institute shows that many Canadians are worried about a second wave.
It's been a long and difficult period of time, and now we're at a stage where thinking to the next wave, the impact on mental health.
Roughly half of those surveyed believe economic damage from a second wave would be worse than the first. A majority of Canadians say another lockdown would hurt their personal finances. And at least 65% say another lockdown would affect their mental health. Health professionals say they're not surprised.
I'm not surprised because I'm personally sort of thinking about that and wondering how it's going to go and having so much uncertainty.
The very thought of it probably does lead to folks feeling a sense of worry and anxiety about what that might mean.
Both Peak Resilience and the Canadian Mental Health Association say demand for services has increased since the start of the pandemic.
We've seen, particularly in one of our programs, Bounce Back, which is our depression and anxiety care phone program, at some points a 100% increase in the number of referrals coming into that program compared to last year.
But instead of worrying about the unknown, there are a few things you can do to feel better.
Right now, focus on solidifying those healthy coping habits. And now is a good time to talk to people in your life and or see if you want to try and talk to a doctor.
1-800-SUICIDE is the 24/7 crisis line here in BC.
In Richmond, Miranda Fatour, City News.
I feel like there's a new wave every week. The numbers go down, the numbers go up, but at least the nice weather is distracting us this week. Hey, Russ?
That's our new coping mechanism. So I'm moving away from boxes of cookies to just handing out, sunny icons in the forecast. But I got to tell you, Mary, there's